Good morning. My name is Dr. Hillel Mazansky. My website being www.gianinc.com, facebook.com/guided imagery, upon which all my YouTube video health tips are placed. If you would like to give my Facebook page a like, you enter to win an iPad. Today's presentation on patients that we've had success in, we will discuss male sexual dysfunction orders, previously known as impotence, today known as sexual dysfunction, impotence, and premature ejaculation. Basically, those are the two major sexual dysfunction orders that we tend to see in males. Now, when it comes to an erection, we are talking about patients under the age of 50. Because after the age of 50, we know that with increasing age, there tends, in most cases, to be some decline in the will to get an erection. The will is there, but sometimes the erection doesn't take place. Not always, for I've had the pleasure of seeing 95-year-old men still having sex once or twice a week. And what it boils down to, my friends, it's all in the mind. Not in the brain, not in your head, but in the mind. There are some medical conditions that are associated with both conditions, but they are rare, such as a low testosterone level, which is extremely rare, low thyroid levels, which is more common. But people tend to want to give it a name and they think it's hormonal. Well, it's not, because very, very few people under the age of 50 have low testosterone levels. However, if the testosterone level should be low, supplementation is in order, but we also have to find out the reason why the testosterone level is low, whether they had previous surgery or whatever. Now, before we begin discussing how medical hypnosis and guided imagery can help, we also want to mention that if you want to perform well during the day or at night, it is necessary for you to have an excellent nutritional program, and it's all complimentary on my website. You can go to the nutrition blogs, nutrition icon, see all my weekly health tips, and you will be empowered as far as nutrition is concerned. Exercise is also very important to maintain a healthy sexual life, and that is mainly cardiovascular exercises. As mentioned on many previous occasions, it is not necessary to go to a gym, but just to walk. Also, having diabetes can affect sexual dysfunction and mainly an erection. Or if you have hardening of the arteries elsewhere, such as heart disease or strokes, the arteries of the penis also become affected if you have high cholesterol. But generally speaking, those are far and few between. What is a major cause of sexual dysfunction amongst men is if you are taking certain medications, particularly antihypertensive medications and antidepressants. They can affect the sexual function or leading to sexual dysfunction. The two patients that we had, one with inability to attain an erection, or the erection was such that it was not sufficient to have sexual intercourse. The second one was unable to satisfy his wife because he was a premature ejaculator. In both these cases, they underwent medical hypnotherapy and guided visualization. How we showed them how to visualize them having an erection or holding back and not being able to ejaculate. But to get them into a deep state of relaxation, we used the medical hypnosis. And And in both instances, there was a tremendous amount of stress in their lives, to the point that they smoked, both of them, and they drank alcohol. The more you smoke, the more you drink alcohol, the more unable you are to have satisfying sex. And at the very cause of them smoking and drinking was stress. Once we did the actual treatment showing them how to attain an erection through imagery and how to prevent ejaculation using imagery and handling the stress, they were healed. Because it's not just by magic, one treatment and that's it. They only have to see me, patients see me one time, but they listen to the YouTube video, the recording, they listen to the recording of the whole session twice every day, and I give them complimentary 15-minute phone calls once a week to top them up and see what issues they are having. And I firmly believe that it's the hypnosis, the stress release, and my following up with them and talking to them that they have become successful. Now, if I've done it for them, why not you who are suffering sexual dysfunction, difficulty with attaining erection, and premature ejaculation? My name is Dr. Hillel Mazansky, and I thank you for listening to the Health Tip.